Welcome to Stress-Free IEP. You do not need to do it all alone. With your host, Frances Shefter, Principal of Shefter Law. You can get more details and catch prior episodes at www.shefterlaw.com. The Stress-Free IEP video podcast is also posted on YouTube and LinkedIn, and you can listen to episodes through Apple Podcasts, Spotify, Google Podcasts, Stitcher, and more. Now, here's the host of Stress-Free IEP, Frances Shefter.
Hello, everyone, and welcome to the show. Today's guest is one of my favorite people, and we'll go into why in a little bit, but it's Dr. Ryan Hinojosa, who is a psychologist, but he is a doctor. And one of the reasons he's one of my favorite people is he's the one that did the private evaluation for my oldest and confirmed what I suspected of autism with a PDA profile. And he just recently, went out on your own. So tell us a little bit about what that looks like and what services you're providing.
Sure. And again, thanks for having me. It's always good to see you and catch up. So I started my own practice about coming on about a year ago. And I tell people it's kind of like this potted plant that I have right now. It's by no means a garden, but I have this little plant that I'm watering. And little by little, it's flourishing into something pretty cool. I see people of all ages. So to your point, yes, I am a licensed psychologist. I am trained as a neuropsychologist, which is just a fancy way of saying, hey, my specialty's in dealing with brain-based, brain-related issues. So these are diagnostic questions pertaining to things like dementia, brain injuries, neurodevelopmental things like ADHD, learning disabilities. My role is primarily in diagnostics. So anytime someone comes with a question, hey, I think I have this, or hey, I think this sounds like me, can you help me? Yeah, that's what I do basically. My practice started out with therapy patients. So I do a little bit of therapy on the side. I see people, like I said, I see people of all ages. It's been virtual up till now, but I'm actually looking at a space in the Bethesda area to call home. So that will allow me to do more things, actual testing, what I'm really trained to do. And so, yeah, I do a little bit of therapy, and as we go forward, I'm going to be looking to do more testing. Families can come see me if they have questions about ADHD, autism, learning differences, and adults can come to me with those questions too, and anything else under the sun that's psychologically related.
So what if there's a family that they don't know? They just like, something seems different.
Right.
What does that look like?
Well, that was kind of your situation, wasn't it?
Yeah.
I think you had an idea about Hannah and what direction we might be heading, but I shared this with you too. When I met her, it was not a clear-cut case for me. We're just interesting as people. Humans are so unique, so diverse, so individualized. We don't fit into neat, refined, carved out diagnostic little boxes. Right. As much as we want to, because we find comfort in that. We find identity, we find reassurance, guidance, hope, all of these things that a diagnosis can afford someone, right? Clarity, really. Right. There are kids out there like Hannah and plenty of other people whom I've met since her who, show a little bit of this, show a little bit of that, a little bit of that that's over there. And we don't know why that happens. That's just our makeup, It's my job as the clinician to give you as clear of an answer as possible in the time I'm allotted. All right. So you've got providers out there who can spend 8, 10, 12 hours with you diving down this diagnostic possibility or this one or this one. There are those of us like me who have 4 hours. Well, 5.5 if you factor in the intake and the feedback and the actual testing.
Right.
So I have a very limited amount of time to figure out what's going on. But I find in my experience, a lot of people have an idea, just like you did,
Right.
way back. And so we explore that idea. And I'm looking at key things like, let's take autism for example. I have a lot of training in this area. And so I know what kinds of things to look for exclusively when it comes to autism. And I find that people will come through my door with this, and this diagnosis, and none of it fits. Right off the bat there, I'm thinking, okay, something's been missed. So many of us have trauma, and trauma can present as ADHD. It can present as a personality difference. It can present as autism in some cases. So I'm sussing out for trauma because that's a common thing. When it comes to autism, I'm asking questions about language. For instance, what's it like to have a conversation with someone? I almost always get really good insight into that question. I'm asking about relationships, and I'm asking about sensory stuff.
Yeah.
Okay.
Which are the three top things with autism? And as you know, having met Hannah, and doing diagnostics on her, like you don't see the autism. You don't know it. There's the sensory issues, but you don't see it. She has deep relationships. She has a lot of empathy. She can have conversations with anyone about anything and just connects, which for me at the beginning was like, that's not autism then.
Right.
Those are key factors, right?
Right.
And it's so frustrating because I've seen several clients that, well, autism was ruled out because there's not these three things. And I'm
Right.
like, but there's these three things. So, right?
I think a lot of it has to do too with like how long we've been in this game. And as long as I've been in it, our perspective and our understanding of autism has changed considerably. We're starting to, well, for some time now, we've been realizing that there are so many nuances to autism. A person isn't necessarily apathetic or not empathic, and that doesn't necessarily mean they're autistic, and we are starting to notice more about the sensory differences. Before, when I first got into this game, we used to almost always assume that an autistic person was developmentally delayed.
Right.
Either they were late to talk, they were late to, use their fine motor skills, whatnot. We know now that that's not always the case. In fact, I can't tell you the last time I met an autistic person who was delayed in talking. So
well, Hannah was, but
well, it's
been a while.
It's been a while, it has been a minute. And so for me, it took having to kind of shed some of that traditional understanding that I had of this profile, a neurotype, if you will, and really kind of open my mind up to some of the other things that we're seeing in this sector of neurodiversity.
Right. Yeah. And I see it a lot also with, schools saying, well, they're getting good grades and they have social relationships, so there can't be anything wrong with them.
Right.
They're just not turning in their assignments. It's like, well, why aren't they turning in their
Right.
assignments? And, it's such a challenge because as we know, especially with going with IEPs and disability codes, you have to force them into one of the 13 categories, even though none of them really fully fit, right? Because it's like there's a little bit of this, a little bit of that. And, the old saying of you've met one autistic child, you've met one autistic child, because there aren't two the same, right?
Right. We used to, it is still considered a spectrum. I don't know if you know who Amy Schumer is. She's a really funny comedian, and her husband is autistic, and she's come out publicly about that. And she talks about neurodiversity and how it plays out in her own daily life. She recently said that she doesn't think about autism as being a spectrum. She thinks of it more as like a constellation. And I really liked that. The spectrum is linear, okay?
Right.
Whereas a constellation is all this, and this is really what we see. And, it's just so different from day to day.
Right. And it used to be, I remember back in the day, if it wasn't before the age of 3, then it's not autism,
Right.
which was so ridiculous because a lot of times kids didn't get to school until 5.
Right.
And if they were home with parents and parents didn't know, who would know to look for it,
Exactly.
And then, yeah. And then they came out with, I'm just blanking on it again. Asperger's.
Yes.
And then remember Asperger's before they changed it totally to the autism spectrum.
Right. We still honor those labels, those identities. But now, yes, like you said, now we just it's just autism. So
right. Yeah. And it's so different. So I know that you go in and like you see a little bit of this and a little bit of that, and you can dig in deeper. I know for me, like I went to private instead of school because school only focuses on the educational. For me, it was also the timing because it was the end of the school year that I really knew for both of my kids. But it's like the school, I don't think the school would have picked up autism on her because of, right?
She's a very dynamic youngster, and she's got a lot of heart, a lot to say, and a lot of personality. And if, stuff like sensory processing differences, things like, language and communication, those things aren't just as obvious on someone like Hannah, someone who's, like I said, got a lot to say. I'm thinking about even some of my own individual clients who are very shy and reserved. And it goes back to this question of what do I say to people? How do I connect? What's the point of all this? They don't all fit that.
Right.
Right.
And people don't see the behind, like, Hannah's always open about it. We've always talked about it. She tells people, and she's okay with that. But it's like people look at her like she can't be autistic,
Right.
like, yeah, wait a few minutes,
She's so outgoing. Yeah.
And the schools do that also because they're like, well, we don't see any of this.
Right.
We don't see that. And it's like, well, because they're masking all day long because they're bright enough to know that they're different and bright enough to know that they need to fit in. And also I see a lot of autistic kids are very rules. If you say A, B, C, then it's A, B, C. So I have to sit here still. I have to sit here still. If it takes all of my energy to sit here still, clearly I'm not available for learning because I'm focused on, okay, still. I can't move, right?
They find comfort in that structure. It feels safe for them. And who doesn't appreciate sameness, familiarity, knowing what to expect? I mean, we all have an appreciation for that on some level. And I'm really glad you brought up the concept of masking. That's something else that has allowed us to understand autism in ways that we never understood it before, especially in our and our youngsters socialized as girls. Girls from a very young age are just raised differently a lot of times. They get the concept of social decorum and how to fit in. It's a society thing. And through that, a lot of them go into deep masking, into deep camouflaging. The same is true for ADHDers,
Right.
by the way.
Yeah.
So,
Yeah.
which we
And
don't
as I
talk
say,
about a lot.
right. And society today is like when boys are rambunctious and stuff, oh, boys will be boys. I'm like,
Right.
yeah, that's not, I hate that. I absolutely hate that. I'm like, really? Really? So boys will be boys. So is that what we're going to say when they're 18 years old doing God knows what out there? Like if that's what you're teaching them now, that's what you're teaching in the future. So let's look at, there's still a way to behave. Yes, boys will be boys, but there's still a way to behave as a boy, you
Right.
know? And you know what? Girls will be girls too, because I know plenty of girls that are tomboyish that are just as active and and that's I don't know, it's just not a thing, right?
Well, masking can be a detriment.
Yeah.
We, unfortunately, there are a lot of young people out there who have that mask on because that's what they think they're supposed to do, and what it's doing is it's taking away from their identity, who they understand themselves to be. A lot of times, I have adult clients come to me and they say, "I don't know who I am. I don't feel like I have an identity. I don't understand me." And it's because they've spent years after year, uh, repressing or concealing who
Right.
they are because they didn't want to be found out.
Right. Yeah.
Um,
And it's so true. And that's why, for me, at least with both of my girls, we talk about it openly with all their diagnosis, like it's, this is who you are. It's just the way everybody's brain works differently. And this is the way your brain works. And so they're open about it and they talk about it, and it's okay because it's nothing to be embarrassed about. It's nothing to hide. I do love now also the trend of not forcing kids with autism to make eye contact and not
yes,
forcing the quiet hands. It's like, you know what? If that's what they need to regulate themselves, then we need to allow them to regulate themselves and give them that space to do that and be who they are, as you said. Right?
yes. I think back to some of my earlier days as a training therapist, where I would, teach how to pay attention, and I would, reinforce like, "Oh, you're making eye contact." It wasn't necessarily with autistic kiddos who traditionally have that difficulty with the eye contact. It was with ADHDers, but still, I kind of cringe when I think back to doing something that what I would see now as kind of forcing someone into something
Right.
that's not really them. The
Right.
utility was different, and maybe the demand was less for this.
But
But
that's the way society was, is that we needed to force kids to fit in, to be I remember back when I taught kindergarten, I had twins, and one of them was
I
always
forget you
bouncing
were
off
a
the wall.
teacher, by the way.
Yeah. And he was always bouncing off the walls. He was just so hyperactive. So what I started doing is he used to do my bulletin boards.
Mhm.
He would be up, putting up my bulletin boards, taking them down. I would tell him what to do. And at any point in any lesson, I could ask him a question and he was spot on, knew the answer.
Nice.
But he just needed that something else to do, to that outlet for his energy. And then he
Absolutely.
could focus. And that's,
Absolutely.
like that's the learning how to, what you need and who you are. And being able to advocate for yourself also is the other thing.
Well, and
Right.
just from a parenting point too, like something that you said that I really appreciate was how you're raising your kids right now. You're normalizing like, hey, these are the ways that you're different, and there's nothing like you're totally disarming them from that shame that can come with something like a mental health diagnosis or psychological diagnoses. And what you're really doing is you are teaching self acceptance, a
Yeah.
critical thing when it comes to a healthy self-esteem.
Yeah.
Um, And I have to point that out. I hope that parents out there who are listening see what we're talking about here is the importance of self-acceptance. We are, these are the cards we're dealt with. We have to work with what we've got. We have to accept them. And only then can we be our true best selves.
Right. And I say it all the time, is that I want to raise children that are self-confident, that have, that are self-aware and accept themselves and love themselves.
Right.
If I need to focus more, and I say this all the time, like them out front playing, I'm looking out front playing with their friends. You know what? I don't need them to sit down and do another hour of math.
Right.
I need them to be out developing their relationship skills and playing with the friends and being outside and being a kid.
Right.
And so like, that's my thing with homework, which of course I have lots of teacher friends that are like, what do you mean they're not doing their homework? Well, what, it's going to impact their grades. I'm like, and like, like
little known secret, it doesn't really count until you get to college.
Exactly. Maybe in high school to get into college, but like, but I was gonna think, even in college, I didn't do that great in college. I still managed to go to law school and make it on law review. You know what I mean? Like it's like, once you know where you want to be and what you want, you'll get there. It's just that, for me, like, I want them to be happy and well adjusted.
There's more to
learn,
life,
Right. Yeah. It's not all about school. Like, I know so many kids, and I've seen it so many times, that are so much pressure on themselves of like, they have to be the best. They have to get the straight A's. They have to be the best hockey player. They have to be the best drummer. They have to, all this stuff. And they're going here and they're going there and this activity and that activity. And I'm like, when do they get to be a kid and just be,
Yes. It's a hard balance, I think, to find. As parents, we want to expose our children to everything, to give them an idea of, help them decide what they want and what they like. But there are only so many hours in the day,
Yeah. Yeah,
So.
exactly. And I'm always open to it. Like, my kids have tried a lot of different things and, gotten into it, tried it. Okay. Don't like it. Try something else. And that's okay. I go back and forth though. Sometimes it's like, well, but are they going to learn how to keep going at something until they get better? And then I'm like, they will when they find something that they want to do. Right.
Absolutely. Kids have more agency than you would think, or maybe than some people would think. And I think it's about finding that balance between like giving them enough agency so that they're not so dependent on us, but still giving them that guidance that they need. Right.
Yeah. Like, for Esther, she tried Taekwondo. She didn't like it. And I was like, is she dropping out just because her sister's dropping out though? But she wanted to try gymnastics, and she's awesome at it, and she's great. And we just go, we go to the JCC. We're not in like some major like gymnast, whatever, but she goes and she practices at home and she loves it. And I'm like, okay, so that's what she's going to stick with. Even though she says like she gets frustrated, she can't do a cartwheel yet. I'm like, but you used to not be able to do the splits either. And she's like, oh yeah. And that's the thing. It's like, so she wants to learn how to do it. So she's going to stick with it. So she has that drive when it matters. And do we really need our kids to have that drive to do better if it's not something they're interested in? Right.
I mean, yeah, I tell people a lot of times, if you can find the intersection between what you like and what will make you some money, you're golden.
Yeah.
Okay. Especially my older high school, my older adolescent people, going to college and thinking about careers and whatnot.
Yeah. My husband said it, and he says it to the girls all the time. And I believe 100%. Find something you love to do and then figure out how to make money doing it.
Right. Absolutely. Absolutely. If
So,
anything, I think in a lot of my neurodivergent clients, they have that gift, the gift to be able to really focus on something that means something to them and take it further than any other person would. know about it inside and out, excel at it, thrive in it, and get the passion that they want, that they, enjoy that passion that they get from doing it, whatever it is.
Yeah. And not be afraid of the failure and the whatever. It's like, well, so many other people, failed at it before. So what? Like
That
you got
part's
to
a
fail how many times before you succeed?
that part's a little harder to teach, I will say, but
Yeah.
I'd like to think that most of them get it at some point.
Yeah. I will tell you that Girl Scouts cookie season, selling
Yes.
cookies. So both my girls are selling cookies. They've both been doing it since kindergarten. So Hannah is unbelievable. Like her skills have grown so much. She's learned so much by doing that. Like she can take no now. She also
Yeah.
knows how to not let people say no.
Right. I remember we
And
talked about this. Like, she's pretty serious when it comes to Girl Scout cookies. Like, I remember you
oh
mentioning
yeah, oh yeah, yeah. She is. Her goal this year is 1,000,
that.
and
Nice.
she's at. I want to say she's at 780 right now.
Okay.
So
Wow.
yeah, I know it's insane. It's insane. But she's. I mean, like when it comes to the booths and stuff, she's like, and people are like, "Oh, I'm on a diet." She's like, "Well, we take donations for our local heroes," and then right, and then she's learned. So they're
That's so
$6 a
funny.
box now. So she's like, when people say how much, how much, she says, "Oh, they're $6 each, or 5 for 30." And people hear 5 for 30 and think it's a deal.
Right.
And so they buy the 5 for 30. Like she's not lying. She's not
Like,
saying something, like, and
you
she's
can't
just,
give away all of her secrets, though.
yeah, exactly right. Well, actually, it was funny because at this at a booth over the weekend with my co-tube leader, she made a comment to her daughter like, "Look, now you only have 2 more left to get to your goal." And the guy's like, "Oh, all right, fine." And he's like, 2 more. He's like, "I'll make it 3, so she's over her goal." And
Nice.
then he's like, "Oldest trick in the book, I know, but let's get her there." And it's again not lying, but it's supporting the girls of learning how to develop who they are, and yeah, she's crazy with her cookies. She's insane
Well,
with her
you
cookies.
bring up a good point about what's happening here is it's incidental learning,
Right.
like learning how the world works. And you may or may not get that in a social skills group.
Right.
And if we can empower our kids and adults alike too, to get out there and just be.
Yeah.
If you can just be, see what happens. Try to get over the fear of judgment, evaluation. Just be. And if the right people are out there, they will find you.
Yeah.
It's something it's something I talk about a lot, even with my adult clients. It's not an easy lesson to learn.
Yeah. I remember somebody said once, what can you imagine what you could achieve if you knew you couldn't fail? Right? Because how many times, like, I don't know, I don't want to try that zip line because what if I fall off and make a fool out of
Sure.
myself? You know what I mean? Or, I don't want to try and paint the painting that somebody else did because what if it looks ridiculous?
Right.
And fear like holds us back so many times because of the fear of failure.
It does.
And
It does. And, when it comes to testing can help us understand our kids' fears and the magnitude, the impact it has on them. A good assessment is going to look at that in a few ways, along with all of the other things that we need to know in order to answer the question.
right. And I know just bringing it back around to the assessments is like, not only do you answer the question of what's going on and how the brain's working, but you can also help figure out how the child will learn best, right? And how to interact with your child.
Yeah, in a lot of ways, I do try to get a sense of that. Are they more of a reader? Are they more quantitative? How do you remember things? Like, what kind of studier might you be? Like, do you do better like with audio supports? Are you more of a visual person? We definitely get those details about a person, depending on what kind of testing you're doing. Again, obviously, when you can do a lot in 4 hours, but there's only so much you can do, right?
Right.
So I try to maximize the time I'm allotted. When I was with you guys a couple years back, I was in a setting where I could, spend 8-10 hours with her.
Right.
It makes things a lot easier. Where I'm at currently, in addition to my practice, I have a set amount of time that I have to really use strategically, and but it's possible.
Right.
It's
But you also pull in your evaluations, the parents do checklists, the kids do their own, and schools, the teachers do it as well, hopefully, if
exactly.
they respond.
Oh, yeah.
Yeah, because
Yeah.
you got to get the picture of everywhere. And what I
Mhm.
always say, like, the testing it's a snapshot,
I couldn't have said it better myself, Frances. I think
Yeah.
about it like that all the time.
Yeah. It's the same as standardized tests. I was never a good, I stink at taking standardized tests. I was awful. And so I didn't think I was smart because I couldn't get those scores, and it's like, you know what? It's just a number. It's just a number. It
It's a
doesn't mean, and like, I don't know, I hate standardized tests. I think they're ridiculous because it's also, what if you're having a bad day that day,
right.
or what if,
Hope you're not that day.
right. And like, when you look at the math, is it really the math that they're testing, or is it because you didn't understand the word problem because of the way the language it was written?
Right.
I
I think as consumers of psychological services, you want to work with somebody who's making you feel like you're being heard, like you're being listened to,
Yeah.
and who's asking questions about different things. It's not necessarily who's doing the most testing. The most testing is not always the right approach. It's about how you're using that time.
Right.
And
Right.
like you said, pulling information from teachers, family members. Parents are the experts of their kids. They may not know what it's called, whatever it is, but they know that it's there. You know what I mean?
Right. Yeah. Yeah. I tell families that all the time. Trust your gut.
Yeah.
Parents, caregivers, trust your gut. When something's saying something's not right here, you're right. There's something not right there. Go figure it out. I don't care how many professionals you have to go to, right? Like, because not all professionals are right.
Right.
And not all professionals are as open to seeing what's out there and seeing the whole profile. And I know, like, that's a big thing we discussed also with the pathological demand avoidance
Right.
profile of autism, right? So many people are like, oh, it's not a DSM-5. Well, it doesn't need to be, right?
Yeah, that does get said a lot whenever we're talking about PDA. I don't know. I don't know how enthusiastic I am when it comes to labels. Call it this, call it that, but it's there.
Right.
Just because it's not in the book doesn't mean that it's not a thing. Okay. And, as a clinician, I try to talk about it in the report, describe it as concisely as possible, and really outline what to do about it. Okay, fine. You know that this is what it is. What do we do about it?
Yeah. It's not, it's the importance isn't what we call it. The importance is how do we address it and how do we help the child?
Right. I appreciate the label. I appreciate the name because it gives it legs,
Yeah.
But I'm really more interested in how do we deal with it.
Yeah.
And we could do a whole episode on that probably.
Oh yeah, definitely. So if people are like, oh, wow, he sounds great. He's the doctor I want to test my child. What is the best way to reach out to you and get in touch with you?
Yeah. So right now I split my time between a clinic, a neurology clinic out in McLean. And as my practice, gains more traction, I'm probably going to land somewhere in the Bethesda area. I can be found on Psychology Today, and you can get in touch with me that way. I can see people of all ages in both places. Okay. So yeah, I can definitely share the Psychology Today profile with you. It has all of my contact information. I'm easy to get a hold of. I really am. So
No, that's awesome. And we'll have the link when it gets fully published. We'll make sure we have the link to your profile and stuff. But this has been so great. Thank you so much for coming on the show and sharing all of your wisdom with my audience.
I appreciate that. Thank you. It's always a good time with you, Frances. Always a laugh or two, right?
Thank you.
All right.
You've been listening to Stress-Free IEP with your host, Frances Shefter. Remember, you do not need to do it all alone. You can reach Frances through schefterlaw.com, where prior episodes are also posted. Thank you for your positive reviews, comments, and sharing the show with others through YouTube, LinkedIn, Apple Podcasts, Spotify, Google Podcasts, Stitcher, and more.